afternoon, everyone, and thank you for joining us for this special presentation today, our special program webinar. My name is Brittany Sandage, and I am coming to you live from Columbus, Ohio at the headquarters of Drug-Free Action Alliance. We're excited to have you with us today, and we're very excited to welcome a guest, Dr. Emily Downing, who's going to share with us some of the resources that can be so useful to community partners, to teachers, to professionals across Ohio, but also across the nation. Just a little bit of background into who we are and what we do. Drug-Free Action Alliance is celebrating its 30th anniversary year this year. We have been a prevention providing agency for 3 decades and are so very proud of that. My role at this agency is to support community coalitions and community-based prevention. And one of the ways that we do that is by celebrating the tools, the resources, the innovations that happen at the local level, and the ways communities get messages across and make a difference. So in honor of National Prevention Week, we have hosted a series of events and trainings, webinars throughout the week, bringing different levels of awareness to different topics. Today's theme for National Prevention Week and Making It Count is the prevention of prescription drug abuse, misuse, and opioid prevention. So in keeping with that theme, we have a wonderful presenter and a wonderful topic today to delve into. And if I may, I'd like to introduce Dr. Downing. She is an incredible resource, has been a great friend to Drug-Free Action Alliance, also to our Ohio College Initiative, which is housed here in addition to coalition programs. And she is here to share with us some of the ways that we can make a bigger difference. So Dr. Downing, if I can hand it off to you.
Sure, and thank you for that introduction, and thank you everyone for joining us today. So I'm a clinical instructor in the College of Pharmacy at Ohio State University, and today I'm going to be presenting Generation RX, Educational Resources to Prevent Prescription Drug Misuse. So if you're not familiar with Generation RX, it's brought to you through a partnership between the Cardinal Health Foundation and the College of Pharmacy at Ohio State University. And our goal is to educate the general public about how to safely use medications in an effort to prevent their misuse. So with that, we will go ahead and get started. So by the end of this webinar, participants will be able to 1, discuss the main educational messages emphasized in the Generation RX resources. 2, identify the Generation RX resources available to educate all audiences about medication safety and prescription drug misuse prevention. And then lastly, explain how to utilize these resources, including best practices for delivery and participant engagement. And so real quickly, just an outline for today's webinar. It will consist of 2 main items. So we'll first discuss the Generation RX key messages emphasized throughout all of our resources. And then second, we'll identify the age-appropriate resources available to educate each of the following audiences. So adults, college students or young adults, teens, and elementary students. We'll also briefly explain how to use them. So let's get started by discussing the Generation RX key messages. So to begin, I thought it may actually be helpful to watch a video which is featured on our homepage of generationrx.org. So if you'd go to our website, generationrx.org, this is the homepage that you would see. And we have an icon here on the left, watch our video. And this video actually articulates the spirit and the goals of Generation RX. So let's first watch this video. It also identifies the Generation RX key messages, and then we'll kind of move on with the webinar. That was the Generation RX video. Again, you can find that on our homepage on generationrx.org. And I, as an instructor in the College of Pharmacy, I work closely with other colleagues in our college and with the Cardinal Health Foundation to develop the educational resources that I'm going to present to you today. So if you have any questions as we move this webinar, please feel free to use the chat box to ask those questions. And I'll try to kind of follow that chat box throughout the webinar, but certainly we'll have time at the end for a Q&A session as well. So let's now kind of walk through what are our Generation Rx key messages. So these messages are simple and they reflect the importance of incorporating safe medication practices into one's everyday life. So our first message is to use medication as directed by a healthcare professional. Second, never share medication or use someone else's medication. Third, secure medication through safe storage and disposal practices. And then lastly, model safe medication practices for others. So these are the Generation Rx key messages, and you're going to see how we have emphasized and adapted these messages to each of the audiences that we're going to talk about today. So as the video noted, the Generation Rx resources are free, ready to use, and age appropriate. So what you're seeing on this screen, again, is a screenshot of our home page. And if you click on the Take Action section, it identifies the resources, the educational resources that are specific to each of these audiences. So we're going to actually spend the rest of the webinar reviewing the main resources targeting the first four audiences, so elementary, teen, college, and adults. So let's first discuss the Generation Rx resources for adults. Okay, so the Generation Rx adult resources aim to prevent prescription drug misuse by educating adults about safe medication practices. So the main messages that you're going to see emphasized in these resources are those four Generation Rx key messages that we just discussed. So what types of resources are provided for educating adults? So we provide a facilitator guide, an interactive presentation, and a handout for dissemination. Thus, our suggested program itinerary for adults is fairly simple. So we actually suggest you introduce the program by playing the video we just watched, and then deliver the interactive presentation using the facilitator talking points as a guide. And I'll mention those or reference those in a minute. We then encourage facilitators to conclude with a Q&A session and disseminate the handout either before, during, or after the program, whichever you feel is best. So let's now kind of discuss each of these resources in a little bit more detail. So we'll start with resources for getting started, which is essentially the facilitator guide. And this guide actually consists of 4 separate resources. So what you see on the screen is the overview resource, which identifies the purpose of the adult program, as well as our 4 safe medication practices, or our 4 key Generation Rx messages. But it also identifies the other resources that make up the facilitator guide. So for example, these resources include a getting started guide, which would help you plan your program, an introductory letter, which is actually an editable letter that facilitators can share with the leaders of the organization that you've selected for your program. And then lastly, we've provided a Q&A session guide, which is a list of frequently asked questions by program participants with suggested answers. And you can actually just print that guide and take it with you to your live program. So those are our resources for getting started. Now let's discuss a little bit more about the actual interactive presentation. So the presentation itself is intended to last 20 to 30 minutes, depending on the extent of discussion by the audience. And what you're looking at here, the top slide is actually a snapshot of the program outline slide. And you can see that most of the presentation intentionally focuses on educating adults about how our 4 key messages, it focuses on educating adults about those 4 key Generation Rx messages or safe medication practices. But we also try to spend some time discussing how they can take action at home or in their community to educate others about these important messages. I mentioned earlier facilitator talking points. So as support for facilitators, we've actually provided a separate resource. Let's see if I can get it to come up. There it goes. This is the first page of our Facilitator talking points. So this is a separate resource provided on generationrx.org, and it includes suggested talking points for every slide and the presentation. So again, these are just suggestions. You don't have to utilize them, but if you'd like, facilitators can essentially just print this guide and take it with them to the program and then use them as needed. So that's a little bit more about our interactive presentation. And then the last resource we have for adults is our handout. So this handout is 2 pages. So page 1 is on the left, page 2 is on the right. And on page 1, we discuss how individuals can take action at home by incorporating those safe medication practices into their everyday lives, while page 2 discusses how individuals can take action in their community, as well as learn more on generationrx.org. And again, as a facilitator, you can elect to disseminate this handout before, during, or after the program, or maybe there are other venues, maybe you are hosting an informational booth at a fair or a festival, and you want to disseminate information to adults in your community. So this would be a great handout to disseminate or share in that context. Okay, so before we move on to our next audience, what do you guys think? What venues or settings could you use these adult resources within your community? So if you have any ideas, go ahead and utilize the chat box and type those ideas in the chat box, and I'll share my own ideas here in a minute. So while you guys are thinking of that question, I just wanted to quickly identify where you can find these resources on generationrx.org. So again, if you go to the Take Action section and you click Adults, this is what you would find. Okay, so this is a screenshot from our Adults section on generationrx.org, and you can see that these resources are organized by type. So Section 1 provides our Getting Started resources, and then Section 2 provides the presentation resources, so the PowerPoint, the Facilitator talking points, and the Take Action handout. So some ideas for where you might utilize our adult resources. So you could consider utilizing them in community centers, libraries within your community, maybe with faith-based groups, or even schools if you want to specifically target parents. Okay, so that wraps up our resources for adults. Again, if you have any questions about those resources, please feel free to use the chat box to ask those questions, or you can save them and we can discuss them at the end of the webinar. So now let's discuss our resources for educating college students or young adults. So our resources for college students are actually branded as Generation RX University, as you can see from our logo or icon on this slide. However, these resources aim to educate all young adults, so ages 18 to 25 years old, about safe medication practices in an effort to prevent prescription drug misuse on college campuses. So in addition to safe medication practices, these resources also emphasize a couple of different kind of messages. So the first is key skills for turning down invitations to misuse, and then the second is positive alternatives to cope with the demands of life. So even with young adults, our goal is to instill safe medication practices for life. So I'm trying to advance the slide here real quick. Let's see if I can get it to work. All right, give us just 1 second. Oh, there we go. Okay, so again, sorry for that glitch, you guys. So again, our message is emphasized in these resources. So again, we're emphasizing those safe medication practices just like our adult resources, but we've also added skills to turn down invitations to misuse and positive alternatives, again, to kind of cope with the demands of life. Now, in addition to these kind of added emphasized messages, given the audience, we actually elected to expand the focus areas of our Generation RX University resources to include 3 themes, okay? So the first theme is going to be general medication safety, So again, these resources educate young adults on how to safely use medications with an emphasis on why incorporating these practices in their everyday lives is important. Our second theme, as you can see, includes resources focused on prescription opioid pain relievers. So these resources primarily discuss how prescription opioids can mediate dependency and addiction. They provide guidance on how to safely use these medications if one were prescribed a prescription opioid, as well as they also help an individual identify the appropriate steps to take action in a drug overdose situation. And then the last theme that these resources focus on is prescription stimulant misuse. So these resources address common misperceptions related to prescription stimulants. They introduce skills for turning down invitations to misuse. And lastly, they emphasize positive alternatives to facilitate academic success. So those are our three themes for our Generation RX University resources. So what types of resources are provided? So similar to the adult resources, we have a facilitator guide that provides information needed to plan and present these resources. And then we have three types of educational resources provided. So the first type is activities, okay? So we actually have three activities for use during live educational programs. And as you can see from this table, we have one activity that focuses on each of our three themes, all right? In addition to activities, we also have videos. So there's a unique video provided for use with each activity. And again, as you can see from this table, there is a video focused on each of our three themes. So these videos, not only can they help kind of introduce these activities and add to the discussion generated during a live program, but they can actually be used as a standalone resource as well. And so we actually encourage individuals to share them through digital platforms like maybe email or social media. And then our last type of educational resource are visual aids, okay? So we encourage individuals to print these resources and post them in high traffic areas on campus, and then suggestions for actually maximizing their use are on generationrx.org. So each of these activities serve as a standalone resource, and if you were to implement any one activity, it may take 30 to 45 minutes to complete based upon the extent of your discussion. So our suggested program itinerary is actually just to select and deliver one live activity. So select the theme that you think is most appropriate for your specific organization, and then watch the accompanying video, conduct that activity, and conclude with a Q&A session. Okay, so that's our itinerary, but now let's kind of talk through each of these resources in a little bit more detail. So again, our facilitator guide, you'll find similar sections as the adult facilitator guide, such as a getting started resource, an introductory letter that can be customized, a Q&A session guide, and we have a fourth section that's actually new or specific to our university resources. It's called Activity Snapshots. And this section actually provides a snapshot of the agenda and the required materials for each activity. Okay, so what I want to do now is just kind of review each of these three activities and their accompanying video in a little bit more detail. So the activity focusing on general medication safety includes a trivia game that teaches young adults safe medication practices for life. All right, so this game, it encourages facilitators to actually play the corresponding video. So this is just kind of a screenshot taken from the video. And you can play this video ideally before starting the game, but again, that video can also serve as a standalone resource, and you can share that through digital platforms if you're not interested in maybe delivering a live program. All right. Now, as you can see from the slide on the left, this game actually follows a Jeopardy-like format. So we provide a PowerPoint file, and this is the main game board. So this is all hyperlinked. There's 4 categories, and we encourage participants to work in small groups or pairs to play the game. And as you click on the specific point value, it will link you to the slide with the question, which an example of a type of question is also shown here on this slide. And then we also provide an additional slide with suggested answers. So it gives the facilitator an opportunity to kind of further discuss that question in a bit more detail. Now, just like our adult resources, specific facilitator talking points are included for every slide, and they're available as a separate resource on generationrx.org. So those are our general medication safety resources. Now let's focus on resources about prescription opioids. So the activity focusing on this topic or this theme includes actually a discussion-based activity. So there's a different format here. And this activity involves 3 scenarios. So for example, the slide you're seeing on the left are slides taken from the discussion centered around scenario number 2. So by working through the 3 scenarios, participants will discuss safe medication practices specifically related to prescription opioids. They'll discuss how these medications can cause drug dependency and addiction. And they'll also discuss how to take action in a drug overdose situation. So participants work in small groups or pairs to kind of talk through the prompted discussion questions. So again, you can see those discussion questions are for scenario 2, and then we have a specific slide dedicated to talking points for each of those discussion questions. So for example, the third discussion question for scenario 2, how do you say no if invited to misuse? You can see this slide that we provide with suggestions for possible ways of saying no. Now again, this activity has a video that can be played prior to starting these discussions to kind of help you introduce the topic and the activity itself. But again, if you're not interested in delivering a live program, you can always just simply share this video through digital platforms, okay? Again, specific facilitator talking points are included for every slide and available as a separate resource on generationrx.org. And then our last activity is focused on our 3rd theme, which was prescription stimulants. And so this is actually a skit-based activity. So we have a game, we have a discussion-based activity, and now the format has changed again, and it is a skit-based activity. So the idea here is that small groups create and perform the ending to 3 unique scenes. So what you're seeing on the left is one of the 3 scenes that we would provide small groups. And through these performances and through discussion surrounding those performances, participants will address common misperceptions related to prescription stimulants. They'll practice skills for turning down invitations to misuse, and they'll also identify positive alternatives to facilitate academic success. So again, the facilitator talking points encourages the facilitator to play the corresponding video before you start those skits. But again, if you're not interested in delivering the activity, you can still share this video through digital platforms. And like the other 2 activities, specific facilitator talking points are included on generationrx.org for this activity. So those are our 3 activities and our 3 videos that we have for raising awareness about this important issue. And now I'll just briefly kind of review the visual aids. So there are 8 visual aids in total. And what's nice about these visual aids is that they can actually be mixed and matched to suit your interests. So on our website, you're going to see that the visual aids are actually organized into 3 categories. So we have the medication safety collection, standalone aids, and a personalized aid. And the medication safety collection, that's what we'll kind of start with. Those visual aids are shown on the left side of your screen, and there is 1 poster for each specific safe medication practice, okay? So we actually encourage facilitators to hang these 4 posters together as a single collection as they nicely work together to provide that broad overview of general safe medication practices, okay? Now the 3 posters that I'm about to reveal in the middle, we consider them to be standalone visual aids, meaning that they can work just fine by themselves, but they can also be paired with any other visual aid that we provide. So for example, we have a standalone visual aid that discusses and defines what is prescription drug misuse. We have a standalone visual aid that just focuses on prescription stimulant misuse. And then lastly, a standalone visual aid that just focuses on prescription opioid misuse, okay? And then the final visual aid that we provide is a personalizable visual aid, meaning that this is actually an editable file, so it's provided as a Word doc file on our website, and it identifies resources for getting help. So what we really want individuals to do is to actually personalize this poster with campus-specific resources for where students can find help. So for you to identify what are your campus recovery programs, what are your student health or wellness centers, resources for academic advising and counseling services, etc. And then you can utilize that poster as needed. So just an example of how you might mix and match these posters is, let's say that you want to raise awareness about prescription opioid misuse. So you might print the opioid misuse standalone visual aid, and you might pair it with one of the visual aids from the medication safety collection. So let's say you pair it with the poster that discusses why we should only use prescription medications as instructed. And then lastly, you add the personalizable visual aid about resources for finding help. So again, feel free to mix and match these posters to suit your interests and needs. Okay, so as we kind of wrap up our college resources, again, feel free to chime in. What venues or settings could you use these college resources within your community? Again, if you have any ideas, please feel free to use the chat box to share those ideas. And while you're thinking of that, again, I'll go ahead and just showcase how these resources are organized on generationrx.org. So again, if you go to the Take Action section, but now you click on College, this is what you would find. Okay, so again, the resources are organized by type. So Section 1 provides our Getting Started resources, primarily that Facilitator guide. Section 2 provides activities for live programming. So you can see your 3 activities. So we have the activity itself along with the Facilitator talking points. Section 3 provides our 3 videos, one dedicated to each theme. And then Section 4 provides our visual aids. And again, you can see how they're kind of organized into 3 collections or categories. So just some ideas of venues or settings that we utilize these resources, at least at Ohio State, is we utilize them actually in our formal courses. At student orientations, we work with RAs to deliver these programs in residence halls. We work with Greek Life, even recreational sport organizations, and then just other kind of extracurricular student organizations. So there's lots of opportunities to engage college students on this particular topic. So those are our resources for college students. Again, if you have any questions now, please feel free to use the chat box to ask those questions, or we can answer those questions for you at the end of the webinar. So we're going to move forward to our next audience. Sorry, if I can just get the slide to advance here. Oh, there we go. So our next audience is teens, okay? So now let's kind of discuss our Generation RX resources for educating teens about safe medication practices. So similar to our college resources, our teen resources are branded with a unique theme, and that is My Generation RX. So these resources are appropriate for educating teens in both middle and high school. And these resources encourage teens to essentially incorporate our Generation RX key messages into their individual everyday lives. So the messages emphasized are actually very similar to Generation RX University. They're just worded to be, age appropriate. So we emphasize safe medication practices, skills for turning down invitations to misuse, as well as positive alternatives for coping with the demands of life. So those are messages emphasize what resources are available for educating teens. So again, similar to our other audiences, we provide a facilitator's guide, different activities, as well as a handout. So we all are familiar with the notion that teens have a shorter attention span than adults. So our suggested program itinerary includes actually selecting and delivering maybe 1 to 2 activities, again, followed by concluding with that Q&A session. You can disseminate the handout if desired, if you just feel like that's appropriate for your venue or setting. So let me just briefly overview our menu of activities, and then we'll discuss each activity in a bit more detail. So our menu of activities reflects diversity in group size, length, as well as technology requirements. And this is a table taken from our facilitator guide, so you can kind of use that facilitator guide to become familiar with each activity and help you select, what activity or activities would be best for my particular program. So each activity was actually intentionally designed to serve as a standalone resource. So for example, for facilitators wishing to present a 1-hour program, if it's appropriate for your venue or setting, you could elect to maybe just conduct activity number 2 or activity number 3, as each of them run roughly 45 minutes. However, maybe you think it would be best to actually conduct a couple different activities during your program. So even if you wanted to stick to a 1-hour program, you could conduct the presentation, so activity number 1, and then our skit-based activity number 4, that also takes 30 minutes, or maybe you just conduct one of these. So maybe you just do the presentation or our 30-minute skit-based activity, and then you pair it with some of our minute activities, which is activity number 5. So the point here is that these activities, because they are standalone, or they can kind of hold their own, and they kind of work independently, they offer a lot of flexibility. Okay, so I encourage you, if you're interested in educating teens, just kind of familiarize yourself with each of these activities and figure out, what do you think would work best, again, for your specific audience. Okay, so let's review these resources in a bit more detail. So first, our resources for getting started. So here is kind of what you're looking at is our first page of our facilitator guide. And again, this guide consists of similar sections as the college facilitator guide. So it has that getting started guide, activity snapshots, an introductory letter, and a Q&A session guide. But it does have a 5th section titled Staying Connected. And this section is actually a list of pre-populated prevention messages for facilitators or other youth organization leaders to tweet, text, or post to teens through. So those are our resources for getting started. And now I'll just briefly review each of our 5 activities in a bit more detail. So our first activity is an interactive presentation, and a slide from that presentation is showcased on the left of your screen here. So this presentation does focus on teaching those safe medication practices to teens, okay? And we try to do it in an engaging manner and in a manner that they will find interesting and relevant. So we do encourage teens to work together in small groups to do a couple different activities throughout the presentation. So they'll work on defining what is prescription drug misuse, what are reasons for prescription drug misuse, and what are positive alternatives, again, to kind of cope with those demands of life. So that's our interactive presentation. Our game also largely focuses on those safe medication practices. And the game, what you'll find is that the game is similar in format to Family Feud. Okay, however, we do offer a way to play the game that encourages all teens to essentially participate in every round. So our opener and our survey questions within the game Again, they just continue to reflect those messages we're trying to emphasize. So safe medication practices, positive alternatives, and approaches for turning down the invitation to misuse. And like all of our other we do have specific facilitator talking points for every slide for each of these activities, and they're available as a separate resource on generationrx.org. So those are our first two activities, and now I'll just briefly kind of review activity number 3 and 4, which are actually both skit-based activities. Again, so just give me a second while I try to advance the slide here. So there we go. So this slide reviews our 2 skit-based activities, and I will say that the reason why we actually included 2 skit-based activities here is that because we find that teens really connect with and enjoy kind of using theater to discuss these important messages. So again, we've provided 2 skit-based activities, and I'll kind of review our first skit-based activity, option 1, on the left side of your screen. So this first activity, it actually consists of 2 parts. So in part 1, teens actually will watch a live theatrical performance through a video that we provide on generationrx.org, and they actually watch 3 separate scenes from that performance, and then they engage in a discussion about each scene, okay? Then in part 2, teens actually participate in a skit-based activity to apply what they've learned. So small groups will receive one of the 3 scenes from that theatrical performance, and as a group they have to brainstorm different choices the characters could have made to ensure a more positive outcome. So essentially they travel back in time and they exchange any negative choice in the scene for a more positive choice. Then that group performs their new scene as a skit, where they essentially get to demonstrate how to implement that more positive choice, as well as reveal possibly different, more positive outcomes that could have occurred. Now, the other skit-based activity does not require any technology, so it's really great for venues or settings where technology is limited. So in this particular skit-based activity, we actually provide 4 scenes, 4 unique scenes that present a different scenario where a teen is invited to misuse a prescription medication. So teens are then divided into small groups where they receive one of the 4 scenes, and then their task is to figure out, for their specific scene, what is the best way to handle that situation. So they have to kind of, loosely perform the written scene, but then actually perform how their group has decided how to best handle that situation. So their performance essentially will include their approach for turning down that invitation to misuse, as well as suggestions of positive alternatives for handling that particular issue or situation. And again, specific facilitator talking points are included for both of those activities on generationrx.org. Now, our last activity is actually a collection of very short hands-on activities that we call minute activities. So they each last 5 to 10 minutes in duration, and they exist in 2 forms. So the first kind of type of minute activities are activities for group settings, meaning that these activities will work best where you have a couple different groups that maybe each have 4 to 5 participants, with maybe a maximum of 5 groups, for example, and you can utilize them in different ways. So maybe you utilize one as an icebreaker to start an activity, or to start a program, I should say. Maybe you string 2 or 3 minute activities together to provide, an entire standalone activity, so an entire program that might last 30 minutes. Or maybe you just maybe you're delivering one of our activities that lasts a little bit longer in duration, for example 45 minutes, and halfway between that program you want to kind of pause, reset their attention, and so you're going to conduct one of these minute activities. So again, they're very flexible. We also provide what we call individual activities. So again, let's say you're hosting an informational booth at a fair or festival, and you just want a short hands-on activity to engage teens. You might utilize one of these individual activities. in order to, discuss these issues in an engaging way within that setting. So these activities are very flexible. They can be utilized in many different ways to suit your needs. Now, the last resource we have for teens is a handout. We call it a tips and advice handout. And again, it's here if you think it's appropriate. So you can distribute it, after a live educational program, or you can disseminate it at an informational booth. Again, if you have a booth at a fair or festival, maybe you conduct one of our minute activities and you disseminate this handout. So this is a resource that's available, and if you feel like it's appropriate for your venue or setting, feel free to disseminate it. So again, before we kind of move on to our last audience, what venues or settings could you use these teen resources within your community? So if you have ideas, go ahead and use the chat box to share those ideas. And again, I'll kind of use this opportunity to identify how these, or to show you, I should say, how these resources are organized on GenerationRx.org. So like the other resources, they are organized by type. So again, if you go to the Take Action section from our homepage and you click Teen, this is what you would find. So there's really just two sections. The first section is our Getting Started section, where you'll find the Facilitator Guide, the handout, and that editable introductory letter. And then the second section provides our 5 activities. So you can see for every activity, we provide the activity itself along with the corresponding facilitator talking points. So some places or venues or settings where it may make sense to utilize these resources, again, maybe you partner with a teacher to go into a school and utilize these resources in formal classrooms. Maybe you work with an extracurricular organization at a school in your community. Maybe you work directly with, athletic or sport teams. After-school programming may make sense, or even faith-based groups. So again, lots of flexibility with these resources when it comes to educating teens. Okay, so we are now to our last audience, elementary students. So let's quickly review our resources for educating children. So we've branded our elementary resources as Medication Safety Patrol, and they are appropriate for use in kindergarten through 5th grade. So we know that prescription and over-the-counter medications are typically accessible and visible in our homes. And so with age-appropriate messaging, we believe that we can include children in this conversation. So you may be wondering, well, what would you consider to be age-appropriate messaging? So those messages, if I can get them to appear, are included on this slide, and they're essentially just kind of adaptations of our Generation Rx key messages. So for example, we talk with children about only taking medicine from individuals that a parent or guardian gives permission. The next principle we discuss is to not share medicine or take somebody else's medication. And then the last two principles, really the context is adults. So the principle is to keep medicine in its original container, and explain why that's important, because medicine often looks like candy, but we want to emphasize, adults should be the ones that are storing that medication. And then that kind of leads to our last principle, where we need to make sure, adults are storing medication in a safe place so that children cannot access it as they're quite curious. So by educating children about medication safety, we believe that this helps equip children with a solid foundation for how to safely use medication before they enter their teen or adult years. So what types of resources are available for educating children? So similar to other audiences, we have a facilitator guide, we have activities, and we have visual aids. And this is a table taken from the facilitator guide, and it organizes some of the resources that we have. So for example, we have resources that kind of function as active stations. We have games that you can play. We have supplemental worksheets for children to fill out. And then we also have visual aids. In our suggested program itinerary, we actually provide several different suggestions in our facilitator guide. And again, these resources are very flexible. So it's based upon the amount of time that you have. And we know that, children have an even shorter attention span. So we definitely suggest doing multiple activities and kind of these 15-minute allotments. So for example, let's just say you only have 15 minutes with children. Maybe you just play one of our games. Let's say you have closer to 30 minutes, so you might play one of the games and you might pair it with just one of our active stations. And then if you actually have 60 minutes with children, we encourage you to do 3 or 4 different activities. So maybe you conduct all 3 active stations, or again, you kind of mix and match stations, games, and a worksheet to make up your 1-hour program. So again, just a lot of flexibility with these resources. So let me just showcase these resources in a bit more detail. So the Facilitator guide is formatted a little differently. So it does have an overview, it has a getting started guide, which is what you're seeing on the left side of your screen. But it also has a badge coloring worksheet. So you can actually print this and take it with you to your live program and allow participants to color their own badge and wear it after completing the program. And then the last thing I just wanted to mention is our introductory letter. This is a bit different in that it's actually a letter for parents or guardians that we encourage you to print, sign, and then send home with each child so that the parent or guardian is informed of the information the child learned in your program that day. So those are resources for getting started. And then again, let me just quickly review our activities that we have. So I mentioned we have these active stations. There's 3 stations with 1 activity at each station, as you can see in the slide. And every station is designed for groups of 2 to 8 participants to complete either as a small group or as a partner. So they might spend 10 to 15 minutes at every station. Again, when time's up, they would just rotate to the next station. So as they're working through the activities at the stations, we encourage facilitators to actually walk around and engage participants. Again, facilitator talking points and discussion questions are provided on generationrx.org. We also have 3 interactive games for children to play. So children of any age can play the first game, which helps distinguish the difference between candy and medicine. We do think our second game is more appropriate for grades K through 2nd grade, as it provides very simple scenarios and it asks children to determine whether the character made a good choice or a bad choice. And then our 3rd game we do think is more appropriate for grades 3 through 5. So you can see that it's a trivia game. It does use that Jeopardy-like format, and it primarily discusses medication safety principles. The other category of resources are actually worksheets that children can work on either independently during your program, maybe to kind of wrap up your program, or you can distribute them at the end and have them take it home and they can complete it with their parent or guardian. So again, not all worksheets may be appropriate for every age, again, because we're spanning K through 5 here. So again, we just encourage you to browse the collection and determine the worksheet that you think is most appropriate for your audience. And then our last resource that we provide are visual aids. So we have 3 visual aids for use. And again, these visual aids can be used as a standalone tool. So perhaps they're bulletin board panels in an elementary classroom, or at a panels for a bulletin board at your local library. Or maybe you'll find another use for them by pairing them with another activity. So again, there is some flexibility here with how you utilize these visual aids. So again, you can kind of think about, what venues or settings can you use these resources within your community. If you want to share your ideas, certainly you can use the chat box, but I'll just go ahead and showcase a couple ideas that I have. So certainly partnering with a teacher and going into a school setting, utilizing them in a formal classroom works really well. Extracurricular organizations, you can talk with children through that platform. After school programming, again, any venue or setting in your community where you can, educate children and talk to them about this issue. And then the last thing I have here is, again, just to show you how we've organized these resources on our website. So again, now if you click on Take Action and you click Elementary, you'll find that, again, they're organized by the type of resource. So Section 1 is Getting Started. Section 2 provides our activities, our activity stations. Section 3 provides our 3 games. Section 4 is our supplemental worksheets, and Section 5 includes our visual aids. So that wraps up our webinar, and at this time I'm happy to take any questions. I just realized that I did not include my email here, but my email is Downing, D-O-W-N as in Nancy, I-N-G, .211 at osu.edu. So please feel free to email me any questions, or I'm happy to answer some questions now.
Thank you very much, Molly. This is Brittany again, and we've had a few questions come in throughout the day. One of the questions that came in is just in terms of if they need to evaluate sort of, how the day went, especially at that teen level. Are there any suggestions or any tips or tricks that you may have?
Yeah, so in terms of evaluation, if you go to generationrx.org, what you can find on our homepage is we actually do provide a survey. It's an electronic survey. If you want to evaluate the program, you can have individuals utilize that survey to evaluate the program, and they can actually complete it as a participant, but you could also complete it as a facilitator. If you want a tool where you can share it with the participants and you actually can directly receive that feedback, then feel free to email me. We have created tools around evaluating our resources that we've utilized in the past. We've kind of switched over to this kind of an electronic version, but I'm happy to kind of share those evaluation tools that we have utilized in the past if that's something that works well for you.
Thank you very much, Molly. A couple of the other suggestions, I think they just came to me privately, but we had a couple participants suggest that, having even a booth at some of your local health fairs or your county fairs are a great way just to start these conversations with a few of the tools that you outlined. In that kind of a situation, are there one or two tools in particular you think would be great for sort of that first conversation with folks in a public space?
Yeah, so I think I mentioned in our teen resources, the fifth activity was called Minute Activities, and I would encourage you to look through that resource. So while those activities were designed to target teens, I do think that they could really be adapted to use with any age. And I would say adults too. I don't know about children. So I would take a look there if you want an actual hands-on activity. I think that would certainly be appropriate for teens or adults. We have our handouts that you can disseminate. If you're interested in engaging children, many of our activities you can actually adapt to work with that setting. So for example, our active stations, each of those could easily be done at an informational booth. You could also print off some of those supplemental worksheets that maybe someone could fill out. So those would be the ideas off the top of my head. If you actually get to that point where you're planning to host an informational booth and you want to discuss ideas further, please feel free to email me, and I'm happy to discuss these ideas further.
Molly, thank you so much for sharing your time with us today. This was a lot of great information, a lot of great tools, a lot to go through and to play with and to figure out how to use. For those of you who are on the call and really might want another chance to just kind of listen back to some of the suggestions and the tips that you heard today, for the participants on the webinar, we have recorded this, so when you get kind of your follow-up email later today, you'll be able to listen back to this recording a little bit if it helps you to navigate and to connect again with Molly. We are just so very appreciative of everything that each of you do on the ground every day to promote prevention, to educate communities, and very, very appreciative for Molly for sharing your time. So Molly, thank you again. I hope that we'll be able to have you back again in the future.
Sure, anytime.
All right. Well, everyone, I hope that you have a wonderful week. Enjoy National Prevention Week. Make sure you carry those messages forward, and we look forward to having a chance to work with you again in future webinars. You'll see there's an opportunity to give your feedback, your thoughts, your needs after you receive a quick survey from us today. Please share that. It helps us to make sure that we're bringing you things that are useful, that we're making sure that you're getting what you need, connecting with the professionals who have the tools that are most useful, and even for a sense for us to have conversations and connect to one another. So thank you all very much. I hope you have a wonderful week, and hopefully we will chat with you again soon. Thanks so much.